So my name is Julie Taylor. I'm a senior lecturer in occupational therapy at Canterbury Christchurch University, and our project is called Innovation and Creativity. It's an undergraduate third year module which our students do in the last 6 weeks of their programme. Okay, within the project, students work in small groups, typically 5 or 6 students to a group, to complete a business case based on an idea that they have that might have come from one of their practice placement experiences or something that they've experienced either in the workplace or on voluntary placements that they think is a gap in the services provided statutorily, or things that they think would be useful for occupational therapists to offer in the community, in training, in technology and those kinds of areas. So we've had, for example, projects based around mobile phone apps, we've had projects based on new pieces of equipment, we've had projects based on opportunities for occupational therapists to work in a different way, say in something like a GP surgery, or in areas of the voluntary sector where traditionally there is currently no occupational therapy service. So this might be in something like homelessness services or in prisons and prison services that have traditionally not had occupational therapy provided. Okay, so the Innovation and Creativity module was originally validated in our 2009 validation for the occupational therapy students, and it was a recognition that there was a changing health and social care climate that our students were going to be entering into upon graduation, and we felt that there was a need to embed enterprise and entrepreneurship into the curriculum so that students had the confidence and skills to think of alternative roles and not purely just occupational therapy roles within the workplace. We also recognise that students need the skills to be able to think about how funding streams work, how organisations work, and how they might be in a position where they need to think about bidding, finding grant money and that kind of thing, particularly in the voluntary sector as well as within the statutory services that they traditionally go into. The module runs for 6 weeks at the end of the occupational therapy graduates programme, and they have some formal teaching at the beginning of the module just to set the scene and to provide the resources and to talk through the assessment of the module. But from that point they work within their groups with one of the academic members of staff being mentors to them, so that they are then largely on their own to develop their idea and their project and come up with really creative and innovative ways in which they could present their business case and form a very credible, viable and well thought through idea. We then have a Dragon's Den style presentation that students attend where they get to listen to how other groups have approached the project, but also they get some feedback from some experts on our panel, and we've had a number of people helping us with that, from people from business and from commercial places within the wider world, but also within the university, working with our colleagues in the business faculty and with our colleagues in our research and enterprise department, who have helped very much in helping the students to formulate their ideas and to get down on paper things like the costing and funding streams that they need to demonstrate are a viable way of getting their project off the ground. We currently have 2 or 3 groups looking at commercialising their ideas and actually going ahead with them in the real world and using the business case that they wrote for the academic piece of work as a starting point for commercialising their idea. Students have reported some very wide-ranging learning opportunities as a result of completing the module with their peers and with their mentors, and these have largely been around increased confidence in how they approach organisations, how they approach interviews, sometimes from when they have graduated, how they approach the idea of putting a financial value on what it is that they do, so that they're able to not only use their clinical and therapeutic skills as an occupational therapist to demonstrate their value, they're also able to have a sense of what their commercial and financial value is within the workplace. And this has been very greatly appreciated and received by students in this changing world of health and social care. Most importantly, What students also report is how much fun the module is. They report the ability to be able to synthesise all their theoretical understandings and all the things that we have taught them in terms of occupational therapy theory and practice, and be playful with that and give them an opportunity to be really creative and really innovative in the way that they're able to describe practice and the possibilities and the endless potential that there is within occupational therapy practice in the wider world. As a teaching team, we've gained huge amounts of confidence in our ability to be able to mentor the students and build the relationships that we have with them, which again is a lot of fun for us. And we find that although the 6 weeks is exhausting, it is also incredibly intensive and incredibly fun to actually be a part of. We've also found that directing small groups of students in a kind of strategic way has been very helpful to give us ideas about the way in which we teach, the way in which we can guide students, particularly towards the end of their programme when they're starting to look for jobs and look for opportunities within the wider world. And this has actually helped us to understand what is going on out there and what is going on in this changing and dynamic, movable feast of health and social care when we're not always directly involved with that, and the students provide that link for us, and that has worked so well for both the students in us being able to mentor and guide them, and also for us to hear back about the ideas and innovations that are going on in the wider world. It has been a fantastic opportunity to work on a project like this, and also for us to now be able to use the HEA as a vehicle to getting it known in the wider community. And I hope that by this process of us using the HEA as our support system and as a support network, we can disseminate the information that we've gained as a result of being involved in this module and the development of this module. The module continues to develop, and we now have a new validation for our September 2012 students, and it has changed slightly in the fact that it is now called Innovation and Entrepreneurship, which we hope better reflects the business element of the module. And we want to continue to foster within our students the opportunity to think about projects that are ethically and morally sound as well as philosophically sound, that can fit both within a clinical and therapeutic world but also within a corporate and financial world, which the reality of our practice currently is moving in the direction of.